Hey, hi everybody. So today I'm going to talk about COVID-19. It's COVID-19, coronavirus disease 19. So initially, it was called the 2019 novel coronavirus. So I think after the disease progressed towards to pandemic, it was changed to COVID-19. So what is COVID-19? So COVID-19 is basically an infectious airway disease caused by coronavirus, uh, caused by novel coronavirus, particularly SARS-CoV-2. So SARS basically stands for S. It stands for what we call severe acute respiratory S syndrome, and then this one is coronavirus 2. Yes, so this is the name of the virus which causes COVID-19. So coronavirus is a group of family. This is a family of viruses. Coronavirus is the family of viruses causes different illnesses. So SARS, severe acute respiratory syndrome, COVID-2 falls under coronavirus family. So, and also we have other viruses which cause common cold, flu, etc. So there are what we call predisposing factors. Yes, so predisposing factors. So we're going to what we call predisposing factors, predisposition to COVID-19. So number one, we have what we call age. So age can predispose a patient to COVID-19. So especially those from 65 years and above, they are prone to COVID-19, and they are at risk of severe complications due to COVID-19 because as someone ages, there's a decreased immunity. Yes, because we know the major function of the immunity is to provide protection against invading pathogens. So if someone has got an intact immune system, it can fight the infection, it can prevent. And then the other predisposition or predisposing factor is what we call underlying health conditions, or in America they like pre-existing health condition. So people with cardiovascular diseases, with diabetes, so both type 1 and 2 are at high risk of having coronavirus. So under cardiovascular, so examples of cardiovascular disease which can predispose someone to coronavirus is hypertension, coronary heart diseases, as well as heart failure. So basically, especially if someone has got cardiovascular diseases, they are prone to complication associated with with COVID-19, especially the formation of or okay, this cardiovascular disease can, if someone acquires COVID-19, can increase mortality rate, can increase mortality rate in a cardiovascular patient. So due to the fact that there's high risk of clotting, and this can lead to myocardial infarction or cerebral accidents. So cerebral accident, we're talking about stroke, paralysis. So that's why during COVID, especially in 2021, most people with cardiovascular diseases, they died. And also chronic, this is the third predisposition. So chronic respiratory diseases such as chronic obstructive pulmonary disease, COPD, and asthma can predispose someone to COVID-19. And also we have the third, kidney diseases, and also there's a very interesting predisposition, cancer patients, especially those undergoing chemotherapy, because the chemotherapy can basically weakens the immune system. Yes. And also we have those, what we call those with the immunocompromised state, such as HIV and AIDS patients, or those on meds such as steroids. So steroids, example is prednisolone. So this can suppress immunity. And also there's also what we call genetic factors. So we can put this as I think the seventh predisposition, genetic factors. So genetic factors can affect the immune response to SARS, severe acute respiratory syndrome virus causing COVID-19. So they're saying the mutation of the gene associated with the ACE2 receptors can predispose someone to COVID-19. So the other factors I'm going to group, such as the socio-economic factors. Socio-economic factors such as lack of access to healthcare, especially in developing countries, can predispose someone to COVID-19. So how? So lack of access can delay diagnosis and treatment. And also there's what we call occupation also. So especially jobs requiring close contact to patient can lead to COVID-19, such as nurses, caregivers, lab techs, doctors, etc. And also under socioeconomic, you have living conditions, so crowded houses or neighborhoods can predispose someone to COVID-19. And also there's an interesting part of ethnicity and race. Ethnicity and race. So ethnicity and race. So according to literature, they are saying some ethnic and racial groups have been disproportionately affected by COVID-19, often due to a combination of genetic factors, underlying health condition, socioeconomic factors, and healthcare disparities. So this can predispose. So quickly, let us look to okay, how is it spread? So it's basically spread through respiratory droplet. So when an infected person, for example, coughs and leaves the droplet on the surface, or maybe can cough and someone can inhale. Yes, someone can inhale. So let me quickly talk about R naught of COVID-19. R naught of COVID-19. So R naught of COVID-19. I think you can. I can't. So there's what they say R naught of COVID-19. So R naught of COVID-19. So before I go to that, first let's quickly go to signs and symptoms. Yes, signs and symptoms. Okay. Yeah, so we'll come back to R naught. I can't find good, but initially they were saying this is an verified information. So they are saying one person. So the R naught can basically mean the degree of transmission. So one infected person could transmit, I think, to 3 people. I can be corrected on this. Yes, I won't comment much. That's why they came that rule that 1 meter apart. So if someone is 1 meter, this person cannot easily transmit COVID-19. So in terms of first of all, so through the droplets, yeah, and then in terms of pathophysiology, yes, how it's transmitted. So initially there was actually I would say hypothesis. So basically this is a supposition, or maybe proposed you proposed maybe cause. So, or maybe in this context, in the context of COVID-19, we can talk about hypothesis in terms of transmission. So they were saying that initially we know that COVID-19 was detected in Wuhan, China, in 2019. So they were saying that initially they were saying that there's a possibility that the bats are the ones which cause COVID-19. They are saying the bats spread it to a pangolin. This is an animal. So the SARS-CoV-2 underwent mutation in pangolin and then spreading to human, because initially they found that when they examined the pangolin, they found that the SARS CoV-2 found in pangolin was similar of that of COVID-19. But later on, they discovered that this is untrue, and currently the precise zoonotic transmission pathway is unclear, is still under investigation. So we really don't know like what really caused COVID-19. But we can explain the pathophysiology, especially for medical students, doctors, nurses, pharmacists, anyone in medical field who wants to know the pathophysiology. So we know that the lung has got the high presence of ACE2 receptors. So, and this disease initially it spread through the lungs, so it enters the respiratory system, and once it enters, it causes once the virus enters into the respiratory system, it undergoes what we call pathophysiology. So the first step is a binding of the COVID, so binding of the SARS-CoV-2. So SARS-CoV-2 is severe acute respiratory syndrome. Yep. So the binding to the SARS, so this is the virus that causes COVID-19, to the ACE2 receptors cells in the lung. So actually, so this, for example, this let's say this is a COVID-19. So this is a example of SARS-CoV-2. So it's just an illustration. So they contain what we call spike proteins. So these spike proteins, they bind to ACE2 receptors. So ACE2 receptors are found in the lung. So it's somewhat similar with HIV. So HIV virus binds to, so through the GP120, yes. So this will bind, cause fusion. So it's somewhat similar with the SARS, severe acute respiratory syndrome, COVID-2 virus. So the binding of SARS-CoV-2 to ACE2 receptors in the lung will cause a confusion, yes, with host cell, and then will cause the end of viral RNA. So we know like what happens. So protein synthesis, let me try to recall the data. So RNA will convert it into messenger RNA. So it should be, I can be corrected, it should be by RNA polymerase. And then this will now, there are a number of events related to formation of proteins. So once the viral RNA enters the host, I think, I'm not sure, there must be something to do like integration leading to formation of DNA, later on protein, a new virus will be formed. Yes, so a new virus will be formed, and then it will cause cell death of the previous infected host cell, and then creating a new virus like that, infect other cells. So the principle, once you know the anatomy, that's why I insist, once you know the anatomy and physiology, even a bit of pathology, you're able to marry, because you know that under virology, when I remember my biology, that the viral cell usually cannot replicate on its own. So no replication on its own. So it requires host cell to replicate. So after binding to AC2 receptors, it replicates and form a new cells like that. This is how it goes. And then this will cause an immune response. So the body now will want, especially if you have a strong, if you are still breathing, so your immune response, whether it's weak or strong, will respond, leading to severe. I want to talk about severe. So the immune response due to pathophysiology of SARS-CoV-2 can do what we call cytokine storm. So this is very important, especially for doctors and pharmacists. That's why they were giving a lot of dexamethasone, cytokine storm. So this cytokine storm was associated with the IS mortality. So especially in the early 2021, people died due to cytokine storm. That's why drugs like colchicine, dexamethasone, hydrocortisone, what else? Prednisolone were used, especially like in severe cases, they are giving IV dexa, hydrocortisone, to try and use, after they discovered that the cytokine storm was killing people. They are giving, and people were told to buy colchicine. This is commonly given to manage gout symptoms. Yes. So this was here. So this is about pathophysiology. So there's a lot. So if you want more information, you can inbox me. But I charge, I can teach you, I can give you more information if you want to read, if you're a student, you want to pass. Because especially wherever you are, especially in Africa, wherever you are, one of the areas that the examiner has to assess medical student medical student, pharmacist, pharmacy students, including interns, and the nurses, whatever. They have to ask about COVID-19 because it's one now. It's very common. So we have talked. I'm even getting tired. So let's go to prevention and general management, non-pharmacological, and then I just want to finish it. Yes, I just want to finish it. So that we continue our series of CVS, because people have been boxing me that can you talk about COVID-19. So we're going to what we call preventive measures. So currently the first one is vaccination, or you can say immunization. So we have a number of vaccines. Those Pfizer, Moderna, Jackson. So this they prevent COVID-19. So we also have public health measures. Yes. So social distancing, wearing of mask, and washing of hands. So they really help prevent. Yes. And also number 2, in terms of preventive measures, regular monitoring and management of pre-existing condition. I'm usually trying to pronounce this properly. So underlying conditions such as cardiovascular, heart failure, coronary disease, diabetes, all those kidney diseases. So also I've got exercise, stress management, diet control. Yes. So in terms of treatment, treatment of COVID-19. So initially treatment was experimental, but right now we have good treatment approaches. So they are saying mild to moderate cases. Yes, so I forgot to mention that the symptoms of COVID-19, so we have fever, we have dyspnea, which is difficult in breathing. It can cause also what we call pneumonia. So pneumonia, which is the inflammation of the alveoli. Yes, so can cause vomiting, can cause chills, etc. So moderate to severe cases, mild to moderate. So they're saying antiviral. This antiviral remdesivir. So this is antiviral. So It helps. So in severe cases, so oxygen therapy is mandatory. So the oxygen therapy. So we have got mechanical ventilation, and then drugs are indicated now in severe cases. Drugs is a must. So if you are a health practitioner, if you're a doctor, pharmacist, nurse, you have to advocate for this. So we have to give anti-inflammatory, such as dexamethasone, hydrocortisone, to try and reduce cytokine storm. Take note of that, very important. And also anticoagulation is indicated, it's a must. So example for anticoagulation, we have Crexcan. If you're in Zambia, Crexcan, which is called the enoxaparin. So this is a low molecular weight heparin, example, highly used. So you have to give enoxaparin to a patient to prevent coagulation, because coagulation increases mortality. Yes. And also we have what you call, so other drugs, like in my practice, even where I work, I've been seeing people being prescribed, even in mild cases. So up to now, the management is a kind of experimental, but there are guidelines. So prednisolone. So this is anti-inflammatory. I won't write the dose. Can be given in mild to severe case. Some doctors prescribe this, yes, just to manage the inflammation. Yes. And also there's what we call superimposed. So sometimes we can talk of differential diagnosis in COVID-19, differential diagnosis in COVID-19. Yeah, so sometimes because the symptoms are a bit similar, so some doctors they treat empirically. Empirically, they give antibiotic. I've seen a prescription of ceftriaxone plus Sabactam. I've seen also a prescription of cefuroxime. Yes, and also in severe cases, patients have been prescribed the imipenem. So these are what we call carbapenems. So these are beta lactam antibiotics. So imipenem plus cilastatin